Welcome everyone to our healthcare technology panel where we're discussing how to streamline unidentified faxes with generative AI. My name is Gabriel Skelton. I'll be your host for today's conversation, and we're thrilled to see many healthcare leaders, over 490 actually, register today. And it's actually no surprise because for this topic, I believe about over 75% of medical communication still happens via fax. We're always obviously in this industry making jokes about fax machines, even though e-fax exists now. And the industry spends about $9 billion annually. That's as of a couple of years ago. So things are increasing. So I think even in 2025, fax is still deeply embedded in healthcare operations because there's so much manual reliance. It's causing inefficiencies, compliance risks, and just unnecessary low IQ work that a lot of people are doing. And the goal is to make everyone as patient facing as possible. So the question is why is the industry still so reliant on fax? And more importantly, how can AI and generative AI and agentic AI and process automation, all these technologies that are booming right now, help modernize to automate these processes? So today, we have an elite panel of experts who I personally know almost all of them, who will be able to help in breaking this down. So let's start with you, Deborah, with a quick intro. I mean, you're from Idaho, you work for Tristate Health, but tell us a little more kind of your expertise and how you apply it today.
Sure. My name is Deb Carpenter. I'm the CIO at Tristate Health. Um, I think in my entire career, we've seen faxing as a solution, and knowing all the issues that come with it, yet we still continue to use it. So my background in this area is just dealing with all the issues, the technical side of all the things that can and will go wrong, and trying to make them better and more secure. And in most recent case, trying to automate some of that work.
Absolutely. Nice to have you, Deborah. And Bob, you're also another Lean Six Sigma black belt along with Deborah, so I'll kick it to you.
Sure. Hi, everyone. It's a pleasure to meet everyone electronically. So I am the CIO here at Mahaska Health. We're based in Oskaloosa, Iowa. And in terms of faxing, yep, just like Deborah, we have numerous fax machines, and we have fax workflow processes that are baked in. There are some manual workflows that we have, unfortunately. The good news is we've recently done some changes within our fax infrastructure to where we have centralized much of it. So there are inboxes, there's better methods of getting those faxes to where they need to be and reducing some of the manual waste that we have. But it's still an ongoing evolution. Faxing is something we've had in healthcare for a very long time, probably longer than many of us on this panel would have expected. And I think it's something that's going to be there. So we have to work through how can we better automate those? How can we better embed whatever the information is into the EMR? And then what type of AI technologies do we have that we can leverage to facilitate that integration and reduce the waste and reduce some of the human-based waste that we have within our processes. Thank you.
Great to have you, Bob. Thanks for that intro. Now let's get into a couple of our RCM experts as well. So, Roquel, if you don't mind, you can go first.
Hi, I'm Raquel. I work for Learn Behavioral and I specialize in RCM management. Currently, we use a lot of faxing. It's something that we love to dislike and wish there was more automation, especially on the back end with claim denials and clearinghouses. So the more information that we know, the better we're able to do and perform our services.
Excellent. Thank you very much, Roquel. And last but not least, Adam, you can talk about your experience.
Hello, everyone. My name is Adam Schambach. I'm the Revenue Cycle Director for Legacy Healthcare Services. My specialty is in RCM. I've been in RCM about 19 years now, and faxing is just a way of life. Most recent role here, we've got the whole RCM, including patient access. So, Raquel just talked about the back end issues with denials, working with payers, even on the customer service side. But on the front end too, we've got issues with authorizations, doctor's orders, especially with out-of-network payers. So faxing just really kind of touches every part of what we do.
I love that. Faxing is a way of life. That should be the slogan of the healthcare industry. So thank you all for joining. I mean, and last but not least, or again, I guess my name is Gabriel Skelton. I'm the head of sales here at OpenBots. And basically, OpenBots is an agentic AI automation platform designed for revenue cycle management and patient intake. Now, the three key areas we'll focus on today is basically why fax is still a challenge, AI-powered automation for fax workflows, and kind of the future of fax in healthcare. So let's get started with our first question. So in terms of how, I guess we'll start with you, Debra, if you'd like. How big of a problem is manual fax indexing in 2025 for healthcare? And I just aforementioned, healthcare spends $9 billion annually, right? And we have, 3/4 of medical communication still happening via fax. So tell us a little more about if you ever foresee the healthcare industry moving away from fax, and what headaches kind of this reliance creates for providers for the fax industry.
Yeah, I think it's unclear if we will ever fully move away from it. It's something that it's easy to use, it's embedded already. The cost is fairly low to implement that technology, if you call that technology, I guess. In these days, it is a little antiquated, but yet we continue to use it. The headaches with that, the problems are, from an IT standpoint, especially, there's a huge security risk there. The faxes are typically unencrypted. You can send them to the wrong number, so you're sharing patient information with the wrong entities. They're inefficient. It's manual. You're sorting through papers. It's prone to human error. Faxes fail for sometimes no reason at all. You just can't even troubleshoot or find where the source of the error is. And I think it's redundant. You see a lot of printing and then scanning, and then just the cost of storage. And then even just the headache of having to have staff do that work manually.
Well said, Debra. Bob and Adam, want to comment on that?
Debra covered a lot, actually. She covered a lot of territory. It's interesting is what I've seen with faxing, and I like how she mentioned that it's inexpensive. And I think that is part, if you want to call it a problem, that's part of the problem is there's a lot of smaller private practices. Is there an echo? Did it go away?
Oh, roll call, you might want to mute. I don't know why it's
Okay. Okay, no worries, no worries. So, I mean, there are a lot of smaller private practices and doctors' offices and smaller pharmacies that, because faxing is inexpensive, it's easy to put into your location, it's easy to set up, and it's easy to use for the most part. And so that just in itself, because of that lack of expense and the need to go much more expensive if you're looking for better solutions, probably going to see it for a while. And I echo everything that Deborah's mentioned is, it is labor intensive. There's a lot of critical processes around, and the revenue cycle experts will be able to weigh in on that. There's a lot of critical processes that get delayed because of what we have to do with faxing. And it's all, until AI comes in and does something in terms of reducing the human-based waste. It's all manual and it's human-based. And so there's errors, there's delays. Manual indexing is something that you have to do, and it contributes to potential fragmented care, and then, as Deborah mentioned, compliance risks.
Yeah, I'd like to add on something there, Gabriel, that kind of echoes both what Debra and Bob said. I think faxing isn't going away because there's a comfort level, especially with providers. I know our company, we do a lot of referrals and a lot of MD orders, and we've tried to implement web portals and other methodologies. And small practices, like Bob said, just don't want to go that route. They'll fax something to you, they might mail something to you, but they're just not interested in looking at this new technology. And I think that's kind of indicative of healthcare in a lot of places where, unless forced to make changes and upgrade and update, people just fall into their comfort zones because they want to treat the patients. They don't want to worry about all this administrative aspects.
Well said, Adam. Hence why a lot of, I think right now there's a boom in the healthcare industry to really rely more and more on automation because the problems have gotten that big. Probably one of the fastest large growing industries in the world right now, healthcare versus, other industries. But Rokel, did you want to, culminate some answers there?
Sure. So in our industry, we see a lot of handwritten notes and images that just cannot be, read by AI. So in that aspect, I don't see manual fax indexing going away. And I mean, it just requires manual review and that data entry to ensure it's entered into systems properly. Headaches, it's time consuming and resources are wasted. And in our industry, time is money. So
Yeah. So I think all of you, especially Debra, touched upon how error-prone faxes can be, and actually 30% of HIPAA violations stem from fax errors, which is ironic because a lot of the reason why the fax, is so prevalent is because of HIPAA, because it's one of the ways that you can actually help become in compliance with HIPAA. But I mean, tell us a little more about these errors and who's responsible for actually managing faxes, because it tends to change from provider to provider depending on what segment you're in. But if you don't mind, team, and whoever wants to go first, who's responsible for this? Who is this affecting? Tell us a little more about the frontline staff and their makeup.
Yeah, I can jump into the fray unless someone else would like to, if that's okay. So I think, there's a number like you just mentioned is errors. It could be an error-prone process. I came from, where I'm at now is a critical access hospital, so it's a much smaller organization. I came from a very large statewide IDN, integrated delivery network. So you could only imagine the amount of faxes that would be coming in there. So huge fax volumes, manual workflows, human-based interaction within those workflows. It increases the risk for misfiling, transcription, potential HIPAA violations. Staffing, that's another thing too, is these areas have a tendency, it could be labor intensive, and how can you staff up very well to meet that type of demand? So sometimes, or you tend to have understaffing within those areas, and then undertrained teams, in terms of dealing with the errors and the compliance, and then just the workload itself. They're going to be reactive. And the last thing too is, I think Debra touched on this earlier, fax systems are outdated. So we can't encrypt them, or if we can, it's not going to be very well. And then having to somehow manually put it into the EMR also increases our risk of compliance issues.
Yeah, similarly, Gabriel, we have over 400 clinics across the country, and our clinical staff has an outsized responsibility for some of the administrative work, including faxes. And, in the therapy world, there's a lot of turnover. So you've got risk of people not knowing, hey, what is the correct fax number for this? What steps should I be taking? So that turnover and just that huge volume that we have creates all of those risks that Bob's talking about, and just makes that risk even greater.
Well said. Debra, Rokel, wanted to comment on that?
sure, I'll speak. From my experience, the responsibility usually falls within, I would say, 2 to 3 departments. Typically, I see RCM, HR, and finance, sometimes lab. But having those established, dedicated teams typically helps with information being, processed to the appropriate team or reviewed by the appropriate team. But as far as the HIPAA violations, it's very manual, and it's prone to human error. So we're looking at the wrong number being added to a fax number, which can automatically create a HIPAA violation. Then if the volume is large, then we're looking at the increased likelihood of overlooking critical data. So that's also can become a HIPAA violation.
And I think
As far as, oh, go ahead.
no, keep going, keep going.
I was gonna say, staffing challenges, like you said, turnover, high workloads, human error, those all play a part. And then you risk the chances of PHI being shared. And so that's HIPAA all over it.
Yeah. I've never met a provider who said, "Hey, I have a low volume of faxes, so it's okay." Go ahead, Deborah, if you want to comment on that. I love that, Roka. Good point. You're muted right now, Deborah.
Wow. Okay. The IT person can't unmute herself. So I wanted to touch on the just the number of people that it takes and the work that they're doing. We are a small organization, 750 employees, and we have 7 full-time people that monitor this. They build charts, so they're taking in all the faxes for referrals. A big one for us is lab results are faxed from all over our region, and they're manually looking at those, determining which patient they go to. Hand entering lab results. It's so error prone. And we get orders through fax, and they're manually doing all that work. And so we are really looking at a way, they're overwhelmed. We need to find more efficiencies for them. So this idea of automating some of that opens them up to do other work. And it also affects the timeliness, especially when we're getting lab results. If you have a stack of papers or electronic faxes sitting there waiting to get entered into the system, if you have critical lab values sitting in a fax, that you're delaying patient care, and you're delaying the whole process of getting your patients taken care of. So something that could speed that up and make it more efficient is patient safety issue, an efficiency issue, all of the things.
Very well said. What I'm hearing is basically, from Bob, some of like how labor intensive the staffing can be, the turnover of staff, depending on what segment you're in, how large the volume is, and basically, Deborah, what you're saying is that a lot of this is still being hand entered, especially like lab results in your world being hand entered. And if there are delays or mistakes, it inevitably delays patient care. So it's a major issue. And Bob, you were mentioning about how, and statistically, 90% of incoming faxes require manual data entry. And 50% of data entered into EHRs is duplicate data entry. So it just compounds the problem. So I guess the next question is in terms of, how this impacts denials and where AI can play. So where do you see generative AI playing a role in addressing this issue that we're talking about of manual data entry into EHRs, handling this large volume of faxes and even, staff turnover?
I can speak to how it would impact if we were able to implement a tool that could recognize those faxes for what they are, something that automatically knows this is a lab result, this is a referral, this is a medical record or whatever, and somehow look at that image and analyze it. The technology is there. Learn what each of those forms look like, learn how to look up a patient, and learn how to take those values and automatically put them into your EMR. And then flag you if there's a potential for error, something doesn't look right, or even flag you if there's a critical value on something that needs to be looked at right away. There's so much potential for the technology that we have now with that generative AI to just automate and take away some of those errors.
And just a follow-up question, Deborah, to that. In terms of, this is a very key question because people in your exact shoes are looking for like, what are the key considerations before automating these fax workflows? Because the technology is there, but it's not as simple as just, hey, let's just use technology. Sometimes there's other considerations of who it impacts, budget, things like that. But tell us a little more of like, what are your main key considerations you're looking at while you decide on bringing this in and even scaling it?
So first, I think you need to look at the quality of the data and making sure that the AI is able to recognize the data. And so you really need to make sure you're getting quality data first so that your models can learn, your data can learn, the AI can learn and handle things automatically. I think you need to look at where AI can actually add value without creating another barrier or another workload, another manual workload. So you really need to identify what those inefficiencies are and make sure that that's not creating another problem. I think making sure it can integrate with your EMR or your revenue cycle system. If it's not going to integrate, you're not going to get a lot of value out of that automation because you're going to have to look at everything anyway. And I think looking at metrics over a period of time to make sure that you're actually being successful with what you're implementing. I think getting buy-in from your team, let them be part of the process to identify those inefficiencies and let them own that. So they're the ones that know that workflow and they're the ones that know what the inefficiencies are, and getting them involved in that project and getting them to have buy-in in what you're trying to do is key. Otherwise, you're going to get pushed back through the entire process.
Excellent. Well said. And Bob, I'll lead on you to speak about it next. And basically, I mean, Debra was talking about how in her world, lab results are basically what's causing the most kind of time suck here, but there are referrals, there's prescriptions, there's so many documents that come in via fax that just add more and more time to being able to have to basically process them. But tell us a little more about your world.
Sure, sure. I mean, there's a number of things that Deborah touched on that are really important. So validating the integration, validating that the AI solution can integrate with whatever EMR you're using, or it supports the standards, like FHIR for interoperability. You have to make sure everything's HIPAA compliant. I know that goes without saying, but you do have to validate that as well. And then I really like Deborah mentioned KPIs. So I'm gonna take a step back for a second related to that is so if we're looking to bring in AI for a certain process, we have to do, and us IT professionals in partnership with the providers, clinicians, and those doing the work, we need to really map out what that process looks like from end to end. So as things come in, who touches it, kind of have like a process map so that way you can, as you're, not to take a step forward, but as you're evaluating AI related vendors, you can see, okay, where is this AI going to have the best benefit, and like what it does, what can it do within that process to reduce waste? And then you can start, like Deborah's point is really good, is how do I evaluate the ROI of this solution? Is, okay, let's start and looking at waste, touches, time taken, those types of things. Get a baseline on what those things are, current state, and then do some test cases, pilot, see how it works within your system, see if you're actually getting the ROI. And maybe the last thing too is just scalability to the solution, depending on your volume. I also, like Deborah, where I'm at today is a little bit smaller organization, but we still have to look at, I think we're still getting a ton of faxes coming in. So we have to think, can this solution scale appropriately to that amount and still be effective? So appreciate it.
Well said. And I'll lean on you, Adam, and Rokel next. But I think what Bob is mentioning is that it's not exactly the most motivating work. I mean, all of you have talented staff and talented employees who do things that technology can't do. Technology is limited. It can never replace a person in terms of interacting with a patient and making them feel comfortable and making sure their needs are met. It just cannot do that, but it can do a lot of the back office rudimentary stuff that takes away from that. But then, I mean, Adam Rokel, it goes down the line and just kind of sifts into the back end of RCM and has so many implications if not done correctly or done inefficiently. So we see that manual fax mistakes drive 30% of claim denials. So that's a very big number just in the beginning of the process. So I don't know, Adam and Rokel, if you want to kind of talk about that and what your thoughts are there.
Yeah, I mean, it does drive a lot of denials, Gabe. I think in our organization, I'm actually thinking about it more in terms of the way Debra and Bob are thinking about it. And Debra said something really, really important. It delays patient care. I mean, we might get an authorization, we might get it faxed, it might be wrong, lead to a denial, but we're also just waiting on it. And then we're waiting on someone to process it and making sure that it's been done, put in appropriately, and all the information's there before we start treating. So not getting to a patient is probably the cardinal sin in our organization. But to your point, we don't do it right, we're gonna have denials on the back end. And with some payers, maybe you can overturn those denials, but some, that's final, and you've lost out on that revenue. And Raquel can say it too, but with RCM, it's all about revenue and making sure we get paid for every claim.
You're correct. I'll jump in. So again, yes, you're right. We need to move away from the traditional way of faxing, and better electronic solutions are out there. And once we're able to leverage AI, we can map them with our clearinghouses, which can significantly increase our payments and reduce our errors, which will lead to less denials. So.
And a follow-up question to you, Raquel and Adam, on this is, what are the main metrics that after, say you bring in automation AI, like what are the main metrics you look at? Because there's so many pieces to it. I mean, it impacts it in terms of the front end, but also go to denials, his patient care. But like Bob touched upon, Bob touched upon just return on investment. But what are the main, I guess, top 3 or top 5 metrics that you would look for to make sure, like, hey, this is helping us, and here's how I know it's helping us?
So, okay, there's a few things that we already kind of measure, but we would be looking at how AI could help us there. From the time that we do patient intake to the first treatment date, we'd expect that to shorten. We'd also expect our authorization denials to dwindle. We expect those to get a lot better. Authorization write-offs. Those are first places off the top of my head that we would be looking for to see those metrics improve to show that the AI is working.
So from my aspect, we're looking at our date of sales of outstanding. We're looking at our aged AR, and then we're also looking at our payments. Are we getting payments in, and are they being posted? Of course, we can get granular, but there's many aspects we can look at to make sure that those faxes are our metrics are being met.
Excellent. So Bob and Debra, they're talking about first patient date, our first payment date, authorization write-offs, days sales outstanding, very common ones, to be able to lower that. Obviously AR, and then are you even receiving payments? But Bob and Debra, what would you add to that in terms of the metrics that are important to track success here?
Well, I think things that we would look at would be maybe the accuracy rate or error rate, processing time. How long is it taking those documents to get through? Cost savings we would track, the ROI, cost benefits. And I think one that gets overlooked a lot, but I think we would look at user satisfaction. How do you measure that? That's a little more objective or subjective, but I do think it's important.
Yeah, I would just, Debra covered a lot on that. I think, and you probably heard me say this earlier, is I would look at process waste. So in addition to the KPIs that are mentioned, I'm just trying to think of ones that would be very easy, well, not very, but relatively easy to tie back to what we've implemented, and process waste could be one that we can do. I've done this in the past, like you can do time studies for workflows and just kind of get a general assessment, like, okay, did this have a positive impact? And but everyone, the rest of the panelists, they covered all the other metrics really well.
I love that it centers around employees and patients ultimately, which is awesome. I think based on what we discussed, obviously fax isn't going away, and 82% of providers still rely on fax machines. But given your expertise with the 4 individuals on this panel, What are your thoughts of what the next generation of a healthcare provider looks like when a fax comes in? Eventually, every provider will have to adopt, same way that every provider had to adopt an EHR, right? There was a turning point that happened in the industry where everyone had to adopt an EHR, and that's slowly happening with everyone needing to move away from solely doing it manually to having to embed technology to automate things to help people out. So tell us a little bit, I mean, and maybe Bob, we can kick it back to you to start. Like, how do you envision the next generation of a healthcare provider? A fax comes in, like, then what happens?
Best case scenario is that fax goes automatically to the EMR, EHR. So however that happens, whether it's an AI solution that's integrated to that EMR, that would, and if OCR is in place, so whatever fax, I think we mentioned this earlier, but if we have natural language processing and OCR in place, that's AI driven, that is very effective at data extraction from those faxes and can actually take that information. And we'd have to look at those error rates because it's going to have to be very, very finite and exact if we were to trust that that information is going directly into an EMR based upon something that was faxed in. So I think that, and I welcome feedback. That's just my humble opinion. I think integrating that straight into the EMR will be the way to go. There'll have to be some human-based interaction though on validation. There really will. Until AI gets to, and I know you're the AI expert, Gabe, you can say whether we're there or not, but I think right now there's still, and just I'm being open out there, there's still a lack of trust around it, and there still is the need for human-based validation on these AI products that are doing the things that they're doing. So that'll likely have to still be in place for this type of solution too.
And you're right, Bob. I think the point is efficiency gains. At a certain point, you'll never move away from people having to take a look and validate things. But I guess what's happened right now is that with OCR, or what's called optical character recognition, it's a 40-year-old technology. It's been around for a long time. But the issue is that before, and by before I mean like even 2-3 years ago, before the whole large language model thing came out, the way you'd approach is with machine learning and having to basically train a model and feed it facts upon facts upon facts upon facts, hundreds if not thousands of faxes for it to be smart enough to one day maybe have enough accuracy to save enough time. That is out the window. That's all antiquated. That's not the way the industry works now. Now there are obviously language models that already understand the healthcare industry, that are pre-trained, that when it sees a document and it says, say, RX on it, it knows it's a prescription automatically without having to configure anything. So it's way smarter now because language models understand plain English language. So instead of doing complex code behind the scenes, you're literally interacting with the document in plain English. It's saying, hey, what is the patient name on this document? It can just tell you with language models. What is the referring physician off of the referral? It can just tell you. Now you have to make sure, being in the healthcare industry, you don't use technology is going to train your data on it, and then your data goes somewhere else. That's the biggest fear. But as long as you can make sure security is intact, the technology is now there as of a couple years ago to basically, yes, have high enough accuracy for data extraction. Besides all of that, Debra, I want to definitely hear your take in terms of what you see as the next generation of healthcare providers. And thank you, Bob, for that informative answer.
I would agree with what Bob said. I mean, he touched on it. It's automatic routing and automatic integration into your EMR. And I think as a result of that, it's better communication, electronic communication. So when that is all automated and it's quickly getting into the right place, if you're integrated with your EMR, I see those systems developing to say, oh, okay, here we have a critical lab value. I'm going to communicate with that provider. Or here we have a denial, an auth denial. It's going to go to someone to take a look at automatically instead of having to be routed manually. I think there's an opportunity to really make this next generation seamless and better communication between all parties. But I also agree there's still going to be some human manual work involved in validating.
Excellent, excellent. Thank you very much, Debra, for your intro there as well. So, Raquel and Adam, I'll kick it to you to give your thoughts as well as the next generation, especially as you go down the line in terms of the RCM cycle.
Gabriel, there's so much happening with AI in the healthcare industry right now. I know we're talking specifically around faxing, but I think there's going to be just a new generation of the way we do things, especially on the RCM piece. But I think it kind of spreads to, I mean, we're talking about AI and recruiting, HR, all the places that talk to each other, credentialing. I think AI with faxing and other areas, it needs to fill in the gaps. Where can we reduce the reliance on people to do that rote stuff over and over again and let them specialize in the stuff that humans need to do? Let the AI do everything that doesn't need us necessarily. Especially around faxing. We've got some process with claims where you bill out a claim to a certain payer and you need to send the medical records up front because it's a specific surgery and they want that so they don't deny it. Okay, how do we automate that? How do we automate that fax to get to them automatically without a person sitting there having to remember, all right, I've got to print these out, I've got to fax these, make sure I send the claim, make sure I did that. Take that out of the equation.
Absolutely. Well said.
Agree. So, in my world, the next generation of healthcare providers will leverage AI-based fax solutions. Um, they're gonna, these systems will integrate OCR and indexing, and they'll automatically extract critical data. For example, we want them to work with our clearinghouses to process claims faster and more accurately. And then this will also help address denials and then also administrative hurdles.
That's awesome. Direct to the point. I think that's excellent. So I think that the last question that I wanted to ask you all, because now we're nearing the end, is basically, and Deborah, we can start with you. What are your top takeaways for providers looking to modernize their fax workflows, or just bring in AI in general into their org, but especially in the fax space? Like, what are your main takeaways or advice that you'd give to someone?
I think you just need to embrace the automation and learn to trust the process. There's a lack of awareness, a lack of trust in AI and healthcare right now. And I think it's coming whether you want it or not. And so you just need to get on board and embrace it. I think making sure that you're conforming to security and compliance. So your solutions need to be secure. I think, again, that seamless integration into the EMR. So make sure that is a functionality of the solution that you select. And I think Bob mentioned earlier, make it scalable. And I think make sure your people are trained properly and that they have the right support. Because if you don't do that, you're just bringing back that vulnerability of human error again. So I think those are my key takeaways.
Excellent. So security, integration into your EHR and other systems, making sure it can actually scale to keep helping, because automation can be 24/7 versus people obviously, 8 hours a day. And then making sure people are properly trained so they can monitor it effectively, use it effectively, and go from there. But Bob, what would you add there?
Well, it's really great to follow Deborah because I think she covered a lot. Makes my life easy. No, not at all. I think the only thing I would add, and I really love that she mentioned the training aspect. A lot of AI adoption within healthcare is cultural. So there is, I think Deborah touched on that. There is some skepticism around it. There's if we want to say that word, there's some fear around it. There's a lot of things swirling out there that can create some anxiety for folks when you mention AI. And something in addition to like the training is develop a culture within your organization and you can do that through communication. I won't go into all the details of a AI strategy, but definitely all organizations need to have one. This is not just faxing, this is beyond faxing, because you need to really be thoughtful about how you're going to look at these solutions, how they're going to help solve issues that are within your organization, and make sure people within the organization are properly trained and know how to use these tools. And then lastly, develop that culture. I know innovations, that word that gets thrown around a lot, but you really want to develop a culture of innovation, and that's across the board. Your providers, your clinicians, your staff or team members, IT. You have to have that culture in place that is willing to not embrace, but willing to, look at things. And here's an issue. Here's something that can be solved by AI. Let's go ahead and give it a shot. And I know agile, fail fast. Give it a shot. Is it something that actually has value for the organization? Is it something that's acceptable for the folks that are using it? And look to use it. And then make sure you want to have metrics in place that monitor that success and value. So get a baseline of your process and time studies and all the other KPIs, whatever you select. Just make sure you have a baseline and use that to evaluate, is this doing what we want it to? So sorry, I was a little wordy there, but that's all I have to add to what Debra said. If she did a lot.
I love that, Bob, especially with the focus on innovation. And before the panel started, we were talking about like agentic AI, agentic process automation, AI agents. This is a new terminology. And the point is that with like robotic process automation, it was all about action and only action. Now it's perception, reasoning, and action, very similar to a human. The thing is that causes even more fear sometimes in the minds because it's like, whoa, we're losing even more control of the process. But the point is, it's powerful technology, but you have to put walls around it. Ensure you use it specifically for what you want. And it's great that this technology now can adapt more, right, than traditional automation, but make sure it can adapt within the four walls of what you want. And then you can use it in a way that diminishes fear because it's working better than before, but exactly within your control of what you want within faxes or within prior authorization or within payment processing or whatever it is that you're actually looking to automate. Wow, Debra and Bob, I think that was very good advice for anyone listening right now. And Adam and Rokel, we'd love to hear from your end as well. Kind of again, the question was basically, what are your top takeaways for providers looking to modernize their fax workflows, or are you just looking to modernize in general?
Yeah, I think it definitely goes above and beyond faxing when we talk about this, Gabriel. It's everything, right? And I think Debra and Bob touched on it a little bit. You got to have trust with the organization. In our RCM, we work very closely with our clinical operations people. And when we first started modernizing a couple of years ago, we just had to build trust with them because the long and short is treating our patients are the lifeblood of our organization. And we need to make sure that the providers can do that. And as long as we're not creating more work for them or creating complications, you're going to have that trust. And I think that's kind of the cornerstone of being able to do new things within healthcare. Make sure your doctors, your therapists, your nurses, make sure that you're supporting them. And then you'll just have that platform that you need to start building off of. It doesn't stop there, but you got to have that before you can build anywhere else.
Absolutely. Absolutely. And Rokel, how will you end us off here?
All right. I would have to agree. So we want to start with a clear understanding of what our AI-based fax solutions can offer. And then we need to evaluate how these tools can address our challenges. And then it's also going to be critical to establish clear processes and assign departmental responsibilities before implementation. And then finally, we want to focus on metrics that matter.
Excellent. So I think just to kind of finish things off, we've covered a lot today. Thank you so much, Debra, Rokel, Adam, and Bob. I think the takeaways here that fax is obviously not going to disappear overnight, but obviously AI and generative AI and agentic AI and automation, it's already making things more efficient. There's so many providers that have already been using it or are scaling. There's ones that are curious. I think this panel is going to help everyone, but making sure you can basically stay compliant, but also stay automated. So when you ask the questions of like, should we automate? Should make this transition, it's more so like, how do we automate? How do we make this transition to make sure that it's secure and also helpful for us? So thank you again. Thank you for sharing your expertise, for joining us. And until next time, I think we'll have a recording of all this for those that are interested in a summary of the webinar, and we'll be in touch. Thanks.